Hello! In the next sequences, we're going to discuss about mental health issues and psychopathology in 22q. In particular, we're going to talk about anxiety and mood disorders, psychosis, stress, and PTSD. But before digging into each of these topics, I'm going to give you some important consideration regarding mental health in 22q. I'm also going to provide some general recommendation about the assessment of mental health issues. Specifically, we're going to talk about 3 different topics: prevention, early detection, and assessment. Let's start with prevention. It's crucial to give some prevention measures for mental health issues in 22q, given that psychopathology is extremely frequent in this condition. Individuals with 22q are more vulnerable to the impact of stress, so it's important to actively explore potential sources of stress. We're going to discuss that more in detail in the next sequence. It's also important to provide support when the patients feel stress, and also to provide coping and relaxation strategies for individuals. Those are all very important prevention measures. We already mentioned in a previous sequence that when there is a mismatch between the individual's capacity on one hand and the environmental demands on the other hand, that this can cause a major stress in the individual. For example, when the school setting is no longer appropriate to the child's capacities, for example. So this is extremely important to tackle very efficiently, as this can be really a trigger of mental health difficulties, and, for example, anxiety difficulties or even psychotic symptoms. When the balance is restored, then mental health difficulties can decrease, unless they have reached a certain threshold that may require then more active interventions. So it's extremely important to actively assess this state of mismatch versus balance as an important prevention measure. Now we are going to listen to Finian's mother, a teenager of 13, who is going to discuss about how, as a family, they learned to keep this balance during periods when Finian had anxiety and sometimes tantrums.
It took me a long time to understand not to put him in situations that would be overwhelming for him, that would cause him to have bad behavior. And I think now we've learned a lot as a family that you don't throw him into a surprise party of 12 people because he won't cope.
So you notice that those events that are especially stressful to him, they can be a trigger of symptoms?
There absolutely will be a trigger of symptoms. So when he was at age, he would be having we would have a play date. It could go great for 2 hours, and then suddenly it would go wrong. Mm-hmm. And so once we've learned his limits, and now I think he's more comfortable, he knows himself his limits and can communicate them, it's easier to manage.
And finally, other important measures in 22q, although there are no studies specifically in persons with 22q, are the importance of maintaining good lifestyle habits. For example, we know the importance of physical activity to promote mental health, healthy diets, and also maintain a good sleep hygiene. In particular, we know that sleep difficulties and especially obstructive sleep apneas are very common in 22q and can cause fatigue, which can also represent a major source of stress. We are now going to move to our second topic, which is the importance of early detection. Again, given the high prevalence of mental health difficulties in 22q, having a person of reference that can be there in case of difficulties is key. In psychiatry, we know that early intervention is crucial in all the domains, and especially in the field of psychosis. We are going to discuss in the next sequence the concept of the clinical high risk for psychosis and how this is important to intervene during this phase in patients with 22q. Sometimes it can happen that youth don't share their symptoms unless they are very severe. So parents are a very important source of information. Interestingly, it has been shown in a previous study that the parent report about their child improves the predictive value about the future outcome. Another challenge that is specific to 22q and other rare conditions is that families live very far away, sometimes from the specialty clinics and the specialists. So there are great hopes that digital tools will help us in the future to really monitor mental health and to intervene as quickly as possible when there are those early warning signals for mental health issues. And now let's move on to our third topic, which are the challenges of assessment of mental health difficulties in 22q. Again, given the prevalence of mental health difficulties, it's extremely important to have regular assessment of a child or an adolescent, especially during periods of high vulnerability, for example, during adolescence and young adulthood. And there are three concepts that highlight the challenges when it comes to the assessment of mental health issues in 22q. Overshadowing, dimensionality, and comorbidity. The first keyword is overshadowing. There are studies that tell us that mental health issues are very common in 22q, but in reality, like it is the case in other populations, like persons with intellectual deficiency or autism spectrum disorders, there is a high risk of overlooking those difficulties in clinical practice. And this is especially due because of the often complex profile of children with 22q. They can have other somatic conditions, they can have intellectual disability. And in our specialist language, we call that overshadowing, when we overlook the presence of mental health issues. And this is very important to counter very actively, because this can create a delay in the treatment of patients with 22q. And this is really a missed opportunity to treat the symptoms very early. Also, when one condition is in the forefront, there is also sometimes a tendency to overlook other conditions that may be present as well. For example, for a patient who has a psychotic disorder, there is a tendency to overlook the fact that there could be also a comorbid mood disorder or an anxiety disorder. So it's really important to assess the broad variety of symptoms that can be present in the same individual. The second keyword is dimensionality. It's important to adopt a dimensional perspective regarding the symptoms of a person. Indeed, it's important not only to assess the absence versus the presence of a specific condition, because often that does not reflect reality. In many cases, a child or a teenager or an adult presents some symptoms that do not match all the diagnostic criteria, but are nonetheless very clinically relevant. So, especially, for example, in the field of psychosis, a child can have some psychotic symptoms even if he doesn't have a psychotic disorder in all the criteria. The last keyword is comorbidity. We know that comorbidity is very frequent in 22q. Often a person meets the criteria for more than one diagnosis at the same time, and this is what we call comorbidity. It's important to assess and consider all the relevant dimensions, and the treatment strategies should take this complex profile into account. Indeed, there is a real danger to really adopt a fragmented approach of mental health in this condition, and it is likely that a holistic approach will provide a better strategic option in the treatment of mental health difficulties. Before I conclude, I would like to provide some important recommendations regarding the assessment of mental health difficulties in 22q. The first recommendation that I already mentioned is the importance to have regular assessment. The second recommendation is always to check whether a symptom could have a somatic or an organic origin. For example, a person having a thyroid problem causing mood difficulties. The third recommendation is to have a multidisciplinary approach when possible. For example, an assessment that combines together a psychiatric and a psychological assessment with several dimensions included, cognition and mental health, for example. The fourth recommendation is to have a multi-informant assessment. We already mentioned the importance of having the parents on board for the assessment, but also the youth should be heard every time during the assessment. The fifth recommendation is to use structured interviews in order to be sure that we are going to cover all the relevant dimensions of mental health. And the final recommendation would be to check always whether there could be a triggering environmental factor that could be really a trigger of mental health difficulties. And if this is the case, to try to address those environmental factors very actively. So to conclude, in this sequence, we have covered relevant information regarding prevention, early detection, and the assessment of mental health difficulties. And in the next sequences, we are going to dig in very specific topics like anxiety and depression, psychosis, stress, and PTSD.